All right. Good morning, everybody. Thank you so much for making time to join us this morning as we have this engaging discussion about immunization. My name is Dr. Veronica Ajewale. I am the Director for the Community Engagement Core here at Texas Southern University. And over the next hour, we will be having a multi-pronged event where we are actually streaming this event live at Estes House. We have attendees and community members and vendors at Estes House this morning. We are also administering vaccines supplied by Walgreens at that location. In addition to that, we are having, this education programming for community members titled An Ounce of Prevention, Vaccinating for Improved Immunity. Coupled with this, we are also providing a DSHIS 1 hour approved community health worker continuing education unit titled Promoting Equitable Outcomes in Vaccine Preventable Diseases Among Minority Population. So welcome on board and thank you all for making time to join us over this next hour as we engage in this discussion.
Texas Southern University's Center for Biomedical and Minority Health Research Community Engagement Core is funded by the National Institute of Minority Health and Health Disparity Research Center for Minority Institutions program. The CEC works directly with communities to identify and address health-related concerns and reduce health disparities related to ethnic minorities. We provide health education and partnerships with healthcare systems, federally qualified health centers, community and faith-based organizations. For more information, visit us on social media at CEC Texas Southern U or give us a call at 713-313-1233 or send us an email at cbmhrcommunity@tsu.edu.
And thank you. That is just a brief information about who we are in Community Engagement Core. So just a couple of announcements. Again, we want to say welcome and thank you to everybody that is joining us either in person or online. We ask that everyone please remain muted. There will be question and answer open during the course of today's presentation. So if you have any questions, feel free to drop those questions in the box and we would have time where our guest speaker will be answering your questions at the end of the presentation. And for those that are at the physical location in Estes House, we have our team members, Dr. Loud, Miss Lena Bean, Miss Christine, and several other volunteers on site that would assist in receiving any questions that you might have, so that we will be able to answer questions at the end of the presentation. And we want to say a big thank you to our partnering hybrid location, Julia C. Estes House. Julia C. Estes House is a gathering place that everyone can count on. For over 75 years, Estes House has been enhancing the quality of life in Houston's Fifth Ward. They also offer an array of support mechanisms that focus on youth development, senior services, social services, and workforce development. We want to say a big thank you and shout out to Ms. Mackenzie, Ms. Marie, and Mr. Williams for helping us as we planned and implemented the logistics for today. And of course, to the Community Engagement Core team members, Dr. Loud, the Associate Director for Community Engagement Core, and Ms. Lena Bean, for putting all the time and efforts together to make today's outreach program a success. We say a big thank you to everyone. Also, we want to say thank you to Walgreens, our partnering, pharmacy service provider, for offering free and low-cost COVID, flu, shingles, and other applicable vaccines at the on-site location in Estes House this morning. We really appreciate Walgreens for the support, and we are grateful that we are able to partner in this capacity. We also want to say thank you to our partner, the Immunization Partnership. TIP is a nonprofit dedicated to helping protect Texans from vaccine-preventable diseases by providing immunization education, promoting evidence-based public policy, and advocating at the Texas Capitol. TIP has a wide variety of partnership within hospitals, universities, community centers all across the state. TIP is making a strong push to engage and empower communities, especially communities impacted by systemic health disparities, to be advocates in education and health of their people. The education is focused not only on vaccine-preventable diseases, but also on how immunization are part of a person's overall health. I will stop here and I would briefly share the information or a YouTube video by TIP. Just give me one moment. Let me pull that up as we hear more information about. So thank you, the Immunization Partnership, for partnering with us on today's event. And we are very grateful for the partnership that we have. I will go back and switch over to my slide as we continue today's programming. And a big thank you, a big shout out to all the vendors that are there at the Estes House location, supporting us and coming out for today's outreach. So we have the in-person outreach that started from 10 a.m. this morning, where we have Walgreens administering vaccination, free or low-cost vaccination to people in the community. So we thank CenterWell, TSU Center on the Family, TSU SHAPE Initiative, Lone Star Cycle of Care, the Immunization Partnership, Q Learning Academy, Texas Southern University's Breast Cancer Screening and Prevention Center, the Area Agency on Aging, Legacy Community Clinic, Julia C. Estes House, the Office of Commissioner Rodney Ellis. We want to say thank you to Walgreens, and also to the greater Fifth Ward Super Neighborhood community. So a big thank you to each and every one of you, our partnering vendors. Thank you for making today's program meaningful and impactful to the community. We thank you and we appreciate our collaboration. And here is, saying welcome and thank you to the community health workers that have taken time out of their day to join us in today's program. So today's program is Dishes Approved, has a 1-hour continuous education unit titled Promoting Equitable Outcome in Vaccine Preventable Diseases Among Minority Population. And this is approved under the Communication and Knowledge-Based Competency. So at the end or towards in the midst of today's programming, we will be posting 2 links for our community health workers. One link would be for you to give us information on how to obtain your CEU certificate. And then we would also have another link about the CEU evaluation. Ms. Roselia, am I missing anything regarding information for the CHWs on how to obtain their certificates? Okay, I think that's all the information we have regarding how to obtain the continuous education credits. So the link will be posted in the chat box, and please complete the information to the fullest so that way we can route your certificates back to you at the end of today's program. And now we want to say welcome to all the community members that have joined us for today's seminar, either online, on Zoom, or in person at Estes House. Today we will be having this program presented by Dr. Flora Estes, where we will be talking about vaccination to improve immunity within the community. For community members, we also want to get feedback from you regarding today's program, as well as any other topic that you would like us to focus on. So we have a survey link that we will be posting in the chat box at the end of today's program. So please, your feedback is very valuable. And please share that information with us, and we will be able to plan accordingly for upcoming events in the future. Again, please use the raise hand icon if you have any questions, or preferably go ahead and post your questions in the Q&A box. Our guest speaker is going to present, and then at the end of today's presentation, we would be able to answer the questions and answers, the questions or comments from community members, as well as from the CHWs that we have on the call. Okay, it is my pleasure this morning to bring up and welcome our very own guest speaker for today, Dr. Flora Estes. Dr. Estes is an associate professor of pharmacy practice, where she coordinates and teaches pharmacy practice courses, as well as R.Ph immunization certification, AHA CPR BLS certification, and dispensing of medications. She precepts both introductory and advanced pharmacy practice experiences for students on academic drug information, clinical and international, which is a study abroad program at TSU. Dr. Estes also assists in coordinating continuous pharmacy education development activities. Dr. Estes promotes research in her involvement as a faculty research mentor for various university summer undergraduate research programs, including the TSU Leadership, Education, and Advancement Pathway programs. Under this LEAP program, she participates in the HEAL pathway, which focuses on health disparities programming for the students in Texas Southern University, which is a primary area of interest. So without further ado, I want you all to join me in welcoming Dr. Estes as we dive into today's presentation.
Thank you so much, Dr. Ajwole. I appreciate that. And thank you for sharing some time with me to share a little bit of information as it relates to vaccines and preventable vaccine diseases. So let me share my screen here with you. So can everyone see my screen?
Yes, we can.
Okay, great. So the title of my presentation today is Promoting Equitable Outcomes in Vaccine Preventable Diseases Among Minority Populations. One of the key words that you see in here is equitable outcomes, equitable meaning equal. If you look at the picture, I think this really explains a lot when it's talking about equality and disparities. So in the first slide, you will see the first picture, systemic barriers that create unequal starting points, even from the beginning. If you notice how the tree is fully slanted to one person's advantage, and they're able with no hesitation at all in picking the fruit from the tree, whereas the other person, they have no access. They're looking like, how am I going to be able to reach the fruit that's on the tree? They're looking bewildered. If you look at the middle box, it shows you that, okay, we recognize that, yeah, there may be, things may seem to be a little bit unequal, so let's do something about it. But what they did was, even though they gave the other person a stool, They also raised the other person up that made them even more accessible to the fruits that's on the tree. And although the other individual now has somewhat access to it, it's still not equal because they're still not able to obtain any of the benefits from the tree. If you look at the basket, one person's basket is full, whereas the other person's basket is empty. And the final one that shows root causes of inequity must be addressed to realize equitable outcomes. So now, even though they have raised the bar, if you will, and so the other individual, they both now can or have equal access to the fruit of the tree, and both of their baskets are full. So we know that inequality that it exists in healthcare and even among vaccinations, immunizations. So our learning objectives today is we're going to look at some of the target vaccines, the vaccine preventable diseases, and also non-routine vaccines. We're going to review and discuss the vaccine schedules for both children and adolescents and for adults. And we're going to also discuss the registries that's available to us, the electronic vaccine health record. So vaccines are considered one of the most successful public health interventions of the 20th century. And I think that we all will agree to that. However, approximately 300 children and 42,000 adults in the US die from vaccine preventable diseases or their complications each year. But in the US, we do have high immunization coverage. So the things that we have seen or heard about in years, centuries even, such as polio, smallpox, measles, and other infectious diseases, they're not occurring like they did back then. They have been successfully eradicated. And every once in a while, we may hear of an outbreak like with measles. And then what happened? We were faced with COVID, and it caused a major disruption in our health system. So it was estimated that about 25 million children under the age of 1 did not even receive their basic vaccinations. And this was the highest number since 2009. And then in 2021, the number of completely unvaccinated children, it increased by 5 million since 2019. So COVID really caused a major disruption in our children being able to be vaccinated. So we're going to have to be especially intentional. We're going to have extra efforts to make sure that not only our children, but our adults, that they are vaccinated. And also keeping in mind as we go into the flu season, so now we have 2 respiratory type viruses that we're combating, that we have to be, again, intentional about making sure that we are covered, and that's the flu and also with COVID. So we want to discuss and look at the vaccine preventable diseases and the vaccines that are being used to prevent them. One of the key takeaways that I would like for you to remember is that it's always better to prevent a disease than to treat it. And that's what your vaccines do. They're given to prevent infectious diseases from even starting and occurring. Therefore, we don't have the disease outbreak, nor the complications that's associated with them. So vaccines aren't used later to try to treat it. We are trying to stop it at the forefront. So this is why we promote vaccines that prevent diseases. So in the US, there are 17 targeted vaccine preventable diseases. So we're pretty much familiar with chickenpox from the varicella virus, diphtheria, flu, hepatitis A and B. Hepatitis A is from contaminated food and water, whereas B is your blood products and fluids from people that are infected. Then you have Hib or Haemophilus influenza, the human papillomavirus. Initially, I believe that this was kind of addressed with girls, but now both boys and girls are vaccinated against this to prevent cervical type cancers, penile cancers as well. Then we have measles, meningococcal, mumps, pneumococcal, polio, which we rarely even hear of anymore. The rotavirus, I think we just had a small outbreak of this not too long ago. And this is very important that we have the vaccine against this because this affects infants, causing severe diarrhea, dehydration, and it really can lead to death. Rubella, the German measles, and then shingles. We know that this is popular talk among adults, tetanus, and then whooping cough or pertussis. So these are some of the non-routine vaccines that's not part of the recommended 17 that we just talked about. Now, these are primarily because they are occurring or related to research type jobs or for people that may be traveling in areas where these diseases are more prevalent. We have anthrax, Japanese encephalitis, rabies, smallpox, tuberculosis, typhoid fever, and yellow fever. So rabies, is probably something that we hear may be being administered because of dog bites and things like that, just to make sure in the event that the dog is rabid or the animal is rabid, that a vaccine is being administered in those cases. And similar with tuberculosis, this is something also that's, pretty popular, especially among healthcare workers, of making sure that your TB skin test is taken. But there are disparities in immunizations, as I mentioned as well. So vaccines, they can prevent illness, but they're only as effective if they reach the majority of the population that's at risk. So there are factors like race and ethnicity, economic status, even locations, where a person lives, whether it's rural versus urban locations. And then there are different reasons that includes cost, just being able to have access to a vaccine or to healthcare. There's coverage, either insurance, no insurance. Then there's, your own attitudes and personal beliefs about vaccines themselves in general. And as we saw in the title slide, there's systemic issues that actually create barriers through various systems. When I looked at the disparities in Texas, and this was primarily in Harris County, which we live, they looked at children among the 2-year-olds between 2012 and 2015, and they looked at disparities as it related to insurance status, socioeconomic, race, ethnicity, and even where people they lived. So this is just some of the excerpts from that when they looked at Medicaid and uninsured populations, again, among 2-year-olds. They showed that they were consistently lower in all vaccines. Now, keep in mind, there were 17 vaccine preventable diseases that we are looking at, and they're saying that among 2-year-olds who received Medicaid or uninsured, that there was lower in all the vaccines compared to those that had private insurance. The only exception was with hepatitis B, and that's because that vaccine is actually given at birth. Within 24 hours of delivery in the hospital system, that child is already receiving their first vaccination, which is Hep B. Then what was also quite noticeable is that when they looked at flu, the seasonal flu vaccination, they saw that it was 18% lower for those that were on Medicaid and 28% lower for uninsured children when it was compared to private insurance. They also looked at 2-year-olds that were identified as Black and non-Hispanic. When they compared them to white non-Hispanics, that they were all lower lower for all vaccines, except again for hepatitis that we said was given at birth, and that 13% lower for Black non-Hispanics when it was when they looked at seasonal flu. And although Hispanic children have similar or high vaccination coverages for most of their vaccines when they compared them to white non-Hispanics, they did see that there was a difference when it was compared to flu, that their rates was 12.2% lower. So we realized that there are gaps in immunization coverage. So in 1993, there was a presidential childhood immunization initiative that started the Vaccine for Children program that occurred in 1994. And since it was implemented almost 28 years ago, we have seen significant reduction in disparities, but yet and still, you know, it still continues. But when we look at the chart, if you look at the chart with me, it shows that the CDC estimates that vaccination of children born between 1994 and 2018, that it will prevent 419 million illnesses, about 26.8 million hospitalizations, and this was compared to the population of the US at that time. Help avoid 936,000 deaths, and this was compared to the population of Seattle, Washington, if anybody's familiar with that. And also it saved trillions, about 1.9 trillion in societal costs and 406 million in direct costs. So we see that this program, that it is providing help for our children in helping to close that gap. So Vaccine for Children's program, these vaccines are offered at no cost to eligible children. And this is by healthcare providers that are enrolled in this program. So if the child is 18 years or younger, they are American Indian or Alaska Native, they are Medicaid eligible, they are uninsured, underinsured, then they're eligible to participate in this program. Just by definition, uninsured means that there's no health coverage at all. Underinsured means that they may have a health plan or health insurance, but either it does not cover vaccines at all, or is limited in the number of vaccines that it will cover, or it will provide all of them, but they place a cap on how much can be spent on vaccines within a time period. Again, a systemic cause of creating disparities. So underinsured children, they are eligible to get their vaccines at federally qualified health centers or some of your rural health clinics. Texas also has a Vaccine for Children program, and it has about 3,000 Texas providers that's in the program. But approximately 3 million of our children, Texas children, are on Medicaid. And what's really discouraging is that Texas leads the nation in the number of uninsured and underinsured children. So many of these children, they're not receiving complete series of their immunizations, actually to get protection. And I just think that this is very disheartening, and I hope that we can help get Texas where we're not being reported as leading the nation in our children not being able to be vaccinated. So now we're going to start looking at the schedules themselves to kind of help you see when your child or you as an adult, what vaccines you need and at what time period. So the CDC does provide parent-friendly schedules. They have one for infant and children for birth to 6 years old. And then they also have an adolescent schedule for 7 years to 18 years. So according to CDC, 18, they're still considered an adolescent. and adults start at 19 years to 65 and older. So this is your childhood schedule from birth to 6 years old. And looking at hepatitis B, as I mentioned before, that they're given their first dose in the hospital of Hep B. Within 24 hours of being born, they are given the hepatitis B vaccine. There are 3 doses that they'll receive between 1 to 2 months, their second dose, and then their third dose between 6 months and 18 months. RV stands for rotavirus, and as I mentioned before, this can cause severe diarrhea, dehydration, and even lead to death. And as you see, it's given beginning at 2 months, then in 2 months intervals at 4 months, and then at 6 months. Then we have DTaP, which stands for diphtheria, tetanus, and acellular pertussis, or whooping cough. So this is given over 4 doses, with the final dose or their 4th dose being given at 15 to 18 months, and then as they go into getting ready for school. One of the things I want to stop and kind of show you with is that most programs target children from birth to like 23 months or 2 years, trying to make sure that those 17 vaccine preventable diseases, that they have them by the age of 2. So this is our target. If we can get them vaccinated within this time period, then we have a major accomplishment. So this is the target, from birth to at least 24 years of age. Then we have the Hib or Haemophilus influenza. This is 4 doses with Hib, the 4th dose being given over 12 to about 15 months. Then we have the pneumococcal, is 4 doses, with the 4th one being given also within 12 to 18. The IPV stands for inactivated polio vaccine. So that's what's being given over 4 doses, with the 3rd one from 6 to 18 months, and then another one as they go into school. Of course, influenza is something that's given yearly. This is given from 6 months to 65 and older every year. The thing to note with the flu virus, though, in the flu vaccine in children 6 months to 8 years of age, that their vaccination is given to them in 2 doses. We get 1, but theirs is given in 2 doses. So they'll get their first shot, and then in about 4 weeks, they'll go back and they'll get their final dose. Then we have MMR, measles, mumps, and rubella, is given as 1 dose between 6 and 18 months, then another dose as we go into school. Varicella or chicken pox, this is also given between 12 to 18 months, and again as they go into school. And then hepatitis A vaccine. This is given over about 12 to about 23 months that this one is given. So 2 doses of Hep A is needed for lasting protection. So they'll get their first dose between 6 and 18 months, and then they should get another, their second dose about 6 months after their first dose. So this is what your childhood schedule from birth to 6 months would look like. This is available on the CDC website. So, if you want to print it out, just kind of track and see yourself for about when your child needs to have their next vaccination scheduled. Then, you can download this and print it and keep it handy. So this is your adolescent schedule from 7 to 18 years. Anywhere that you see in green, this is what is telling you that's recommended for them and within the time period. So for flu, from 7 every year to 18, they should have the flu vaccine done. With Tdap, there's tetanus, diphtheria, and pertussis is showing you that it's recommended that they have this at age 11 to 12. However, if they need to do a catch-up, saying that birth to 6 years old, they missed a dose of Tdap, then they can start catch up at 7 to 10, and again at 13 to 18, should they have missed a dose. With the human papilloma virus, the HPV, this is recommended at age 11 to 12. That's the recommended period. It's given at 11 to 12. However, if there are certain health conditions or lifestyle issues that's going on, then a child can receive it at 9, between 9 and 12. The recommended is 11 to 12, and then a catch up is at 13 to 18. The kind of checkered box there means that it doesn't have to be for any kind of high risk or lifestyle issues. If they want to have it at age 9 and the pediatrician recommends it's safe, it's okay, then they can also start that series at 9 to 10. Meningococcal comes in 2 vaccines. You have your MenACWY, and those are serogroups of the meningitis virus, if you will. The ACWY is just serogroups of that. And then the MenB is the serogroup or type for it. So the recommended is for them to have the MenACWY because it covers more strands, if you will, and it's given at 11 to 12. The purple, again, indicates health or lifestyle issues or conditions. So if they meet that requirement, they can get the meningococcal as early as 7 years of age. And then there is a catch-up between 13 to 18. The green box at 16 means that this is a booster at age 16 if they are given the MenACWY vaccine. MenB, again, if there are some certain health conditions or lifestyle, they can receive the MenB beginning at about 10 to 18. The kind of teal box means that there may not be any kind of issues, health conditions, or at risk. If they need to have the vaccine done during this period that they missed it for some reason, then they can also have the MenB instead. Pneumococcal from age 7 to 18, again, for certain health or lifestyle conditions that may put them at increased risk for pneumococcal, then they can have this as early as 7 years of age. Then dengue is not something that we typically hear about. A lot of this is kind of like in tropical places, maybe if you're traveling or working, doing research jobs or whatever, but this is caused by a mosquito, and it's dengue, is how it's pronounced, and it's only in places where dengue is spread, and it can be given at age 9 to like about 16. With in the gold boxes that you see, again, not the one on the end was really, this one was supposed to be that checkered box that you see here, but for some reason it didn't come out that way. So the shaded gold that you see here, this just means, again, that they're catching up on a missed vaccine, and they can have it within any of these time periods for hepatitis A or B, polio, MMR, or the chickenpox or varicella virus. They're just playing catch up. Maybe didn't have it during those for some reason during the birth to 6 period and needed to make it up. So this is your adolescent schedule. So what about adults? You know, we believe in, I think that as adults, we believe in in immunizations, and we think that it's very important to have. But I think we kind of get caught up in making sure that our children and our grandchildren, that they're vaccinated, that we really don't take into account that we as adults, that we also need to be protected as well from things such as shingles, pertussis, hepatitis, tetanus, all of these things. And if we're not protected, then, you know, it could cause not only result in poor health, but missed work, increased medical bills, and not being able to care for our families. So we need to remember that those childhood vaccinations that we took, that they tend to wear off over time. And so we need to have boosters and things done as well. So tetanus, and we'll look at a little bit more of this in the schedule, but tetanus is something that we should take, and it's given like every 10 years after we have our initial dose. Whooping cough or pertussis, and this one is very important that we get, is because we as adults, we spread this to children. So if you're in a household with a newborn or with babies, as a parent, as a grandparent, a healthcare or a child worker that's coming in to take care of them, it's very important that we're up to date on the pertussis of whooping cough. It's because they get this from adults. It's spread from adults to children. So we need to make sure that we're up to date on our whooping cough. So some of the vaccines that we take as adults is based upon our age, our job, and lifestyle, but it's very important that we get them so that we can, again, reduce our chance of getting sick, and also so that we can eliminate the spread. So as an adult, again, is considered 19 years to 65 years or older. There are some vaccines that we need. So they're saying COVID-19 is one, then of course the flu vaccine every year, and tetanus that I said that was a booster, the TD that we should take every 10 years, and then the Tdap. So if you have young infants, babies, and things in your household, then Tdap is kind of like one-stop shop. You can get your tetanus updated, and you can also be updated with your pertussis vaccine. And then again, there's hepatitis A and B, pneumococcal, and then that old shingles virus, the herpes zoster, that's related to chickenpox or varicella. So this is the schedule. Now this schedule is primarily one that is used by healthcare workers, but all of these schedules can be downloaded from CDC and can be printed out, and they actually come with notes so that you can kind of read and see what the different recommendations and things are. But the first one again is looking at flu. So it's telling you 1 dose annually with the inactivated influenza vaccine. The next one here from 19 to 49, this is for those that are receiving the live attenuated, meaning weakened virus vaccine, that they can give it at 19 to 49. When looking at tetanus, that we talked about, tetanus, diphtheria, pertussis, this is that Tdap or the TD. So it should be given 1 dose of Tdap, should be given from 19 to 65 with a 10-year booster of Tdap or TD, again, every 10 years. Tdap is safe to be given in pregnancy, so they get 1 dose, and this is typically given within the 3rd trimester. And also, of course, since this has tetanus, providing tetanus for wound management, for cuts, burns, things like that, that we want to make sure that we are covered. With measles, mumps, and rubella, we have, this is given basically in 2 doses from 19 to about 64. The gray areas mean that it's not recommended or it's not applicable within for that age group. So with the MMR, however, this is primarily given in 2 doses, and it can be given in one dose. This is what they call contraindicated or should not be given in pregnancy. So as soon as the mother delivers, they can receive a one dose of the vaccine. In non-pregnant women who doesn't have sufficient immunity against rubella or the German measles, they can also receive one dose. But typically this is a 2-dose series for MMR. Varicella or chickenpox is given 19 to 49. And the purple, of course, is recommended if the person is at risk. Like we saw here, this person was pregnant. This was done in womb management. So if there's some type of risk factor or some other indication, then they could also get another dose of at this age between 50 or 65 and older. Also zoster, this is the shingles virus. So we want to take the vaccination at 60 and older. This is the recommended age, is 50 and older. However, if there are, again, some type of risk factors or indications, and they are in an immunocompromised condition, then they can also take this at age 19 through 49. The HPV, depending on when they had it, like as an adolescent, they will take 2 or 3 doses, depending on, when they had their first one. At 27 to 45, if for some reason during this age group that the individual thinks or would like to have the vaccination, this indicates that they talk to their physician about it and they determine whether or not it's feasible or even necessary for them to have the vaccine during this period. Again, the gray area meaning it's not recommended or it's not applicable during this time period. Pneumococcal, 1 dose of PCV 15 followed by PPSV 23 in about 1 year. However, if they are immunocompromised, they can have this other dose within about 8 weeks in about a 2-month period. So they can have either the 1 dose of PCV 15 or the 1 dose of PCV 20. However, if they have the 15, they would have to get the 23 followed by within 1 year, or if they're compromised, they can have it as early as about 4 weeks. 8 weeks or 2 months. But this is really, pneumococcal is really recommended during this age period, 65 years and older. But it still follows, if you get the 15, a year later, you go back and you have the 23. So you can either have the 1 dose of 15 or the 20, but if you get the 15, you got to have another shot of the 23. So these again are targeting certain serial groups to be promote immunity. Hepatitis A, 2 or 3 doses depending on the vaccine that you're getting. Same thing here with hepatitis B, depending on the vaccine. Is either 2 dose, 3 or 4 dose, and it's recommended at age 19 to about 60. And after that, it's only if there are health-related conditions or risk. Same thing with meningitis. Your meningitis vaccines, ACWY or the MenB, as I mentioned before, these are serial groups. So the vaccine is targeting these certain groups. So 1 or 2 doses, depending on the indication, or 2 or 3 doses, again, depending on the indication. These are adults, 19 to 65, over 65 that we're looking at. And also with the Haemophilus influenza or HIB, it comes as 1 or 3 doses, recommended adults with additional risk factors or some other indication as to why they need these particular vaccines. So that is our vaccine schedule. This, I would like to have this link dropped in the chat. This is something that the CDC has put out. It's a very simple assessment tool for adults to use to determine what vaccines that you need. And it's real simple. This is actually the one that I took. And it shows that I need MMR, chickenpox, hepatitis A, flu, Tdap, and also zoster. So I'm happy to say that I'm pretty much up to date on all of this, and it's time for my seasonal flu again. And I have not had a booster of the MMR or chickenpox, so I have to talk to my primary care and see what her thoughts are on having that done. So this is quick and simple. We'll drop the link in the chat and you can kind of try it out. Good thing about it, you can print it out, take it to the doctor, and y'all can discuss it. So pregnancy and vaccines, let's take a look at that. As I mentioned before, MMR vaccine is not given in pregnancy, during pregnancy, but it can be given at least 1 month or more before pregnancy, or if, of course, after pregnancy, it can be given, but it's not given before because it contains a live virus. During pregnancy, the Tdap that I had mentioned, tetanus, diphtheria, and pertussis, is actually given during pregnancy within that third trimester between 27 and 36 weeks, and it actually helps to protect the baby before in utero, helps to protect the baby against whooping cough. So it's very important that our pregnant moms, that they receive the Tdap. If they can also have it if they've never been vaccinated, or if they're not really sure if they had it or not. And if a woman has delivered and has not been vaccinated, then of course she can be immediately vaccinated after she has delivered. Again, as I mentioned, family members, close caregivers, they should receive this because we actually pass this on to children, to our infants. So we want to make sure that we're up to date with that. And of course, during pregnancy, they can have the flu vaccine. It doesn't matter at what stage, flu vaccine is recommended during pregnancy. They suggest that it be given like during, at least during October, because this is when they noticed an increase in the virus increasing. So they're saying that at least by the end of October, that's kind of like right at the beginning of flu season, is that they have it. And the nasal spray is not recommended during pregnancy, again, because this also is a live vaccine. After pregnancy, it's safe for them to receive any vaccine after giving birth, even while breastfeeding. It's shown that it's still safe and that it shows no risk to being passed in breast milk or being hurting the baby. COVID-19 vaccine is also recommended for pregnant people. So let's take a look now at egg allergies. So some people are allergic to eggs, and some, mostly like our influenza vaccines, are made with trace of egg elements, if you will. So they say that if you can eat like a scrambled egg and you're not having any kind of problems, that you really don't have a true egg allergy. But if you're having respiratory issues, you have to use EpiPen and those types of things, then yeah, you probably have a serious allergic egg allergy. However, you can still have the flu vaccine for two reasons. One is because we have egg-free products. Flu Block is approved for age 18 and older. Flucelvac is also approved for 6 months and older. And even if you're not getting the egg-free products and just getting one of the regular vaccines, flu vaccines, and you have a severe allergy, you just have to get your shot at your doctor's office, or where a healthcare provider can actually watch to see if you have an allergic reaction, and if so, they're able to treat you there. So let's look at the flu vaccine that comes as a nasal spray. So it's like, oh yay! Instead of getting a shot, I'll just get take the nasal spray. Sorry, it's only available for 2 years to 49 years old, and it's approved for youth and healthy non-pregnant people 2 to 49. So you can't take flu mist. First of all, it's administered as a live vaccine. So if you have allergic reactions to any ingredients in the vaccine or to previous doses of any flu vaccine, then you cannot use the nasal spray. If a child less than 2 years old, 2 to 4 years, and you have asthma or a history of wheezing in the past 12 months, you cannot use the nasal spray. If you're a child 2 to 17 years of age and you're on aspirin type therapy medications, you cannot use the nasal spray. Adults 50 years and older, pregnant people, and some other medical conditions, I'm sorry, but you cannot use the nasal spray. There's been some question about autism and vaccines. So vaccine-related autism. Autism is a neurodevelopment disorder. And there was some belief that thimerosal, which is the mercury-based preservative that was in the vaccines, was causing autism. Now, thimerosal, again, is a preservative, and primarily it was in multi-dose vials, trying to protect them from any type of bacteria as they go in repeatedly to withdraw doses. So this is why the preservative was being used in multi-dose vials. However, it's a different form of mercury. Thimerosal is a different form of mercury. It's ethyl mercury, and it's ethyl mercury and not methyl mercury. And this is the kind that you would see in fish that can actually create poisoning, mercury poisoning. So it's different. And the ethyl mercury is processed differently in the body. It doesn't build up. It's only used in small amounts. Studies that were done show that there was no link between receiving vaccines and developing autism. However, to be precautious on, erring on the side of caution, they removed or they reduced thimerosal in vaccines in 1999 and 2001. So just to note, MMR, that's your measles, mumps, and rubella, varicella, polio, pneumococcal, they never had thimerosal in them anyway. They weren't developed that way. All vaccines that's routinely recommended for children 6 years of age and younger, there are formulations that don't contain thimerosal. So there are thimerosal-free products, thimerosal-free, preservative-free vaccines. You just ask your pharmacist or your healthcare provider, that you want the preservative-free. If you still have doubts and skeptical about the studies that show that there was no link between them. So again, there are formulations that are preservative-free. And also they went another step. So now instead of having all of those multi-dose vials, they've created single-use vials, and now they don't have to use the thimerosal in those. I would be remiss if I didn't talk about COVID-19, just to make our story a little bit complete. So now we have 4 providers. We have our Pfizer, BioNTech, Moderna, Janssen, or your Johnson & Johnson product, and now we have Novavax. Now, all of these give your primary series. However, Novavax has not been authorized as a booster as of yet. So the CDC recommends that you have the primary series vaccine, and now 6 months and older, you're eligible for the COVID-19 vaccination. Boosters should be given if you're 5 years of age and older, if you're eligible, based upon other health conditions or concerns. And then a second booster is also being recommended if you're 50 years in age or older, or you're 12 years and older and you have a moderate or severely immunocompromised conditions. The CDC recommendations, of course, all of this is based upon whatever the latest data that they have regarding safety and how the vaccines are working, including how they're looking at how they work over time, and also the new variants that continue to kind of occur. One thing that I wanted to share with you is about Evolshed. This is not a vaccine. It's a medicine that's given by your healthcare provider. And this is an investigational medication right now, and it's part of the emergency use authorization. This contains 2 different types of antibodies that help prevent COVID-19. This is pre-exposure. So it's used in adults or adolescents that are 12 years and older that weigh at least 88 pounds. They have not been infected with, they're not currently infected with COVID-19, has not come in contact with anybody who's had it. They are moderately or severely immunocompromised, and so they may not have an adequate immune response when they took the regular vaccinations, or there was a history with those vaccines, the COVID vaccines that they did take. So these are the criteria for being able to try this product. It has to be given in the healthcare provider's office, and is given as 1 dose. So it consists of 2 separate injections that's given at the same time. So you get, as I told you, there are 2 antibodies in it, this HVMAB and the Sagaviamab. So you're getting 1 dose of each of those intramuscular, and they'll watch you for at least an hour just to observe and make sure that there's no allergic reaction. So if this is something that you think you may be interested in, speak with your healthcare provider and talk it over with them. Okay, so we've talked about our vaccine preventable diseases and some of the programs that we had out there, about the types of vaccines and things that we need. So now let's look at reporting and registration. So we can't talk about vaccines without also kind of going over if we have any type of adverse reactions. So note that if you're having any type of adverse reaction, you should first talk to your healthcare provider, but there's also an agency called VAERS, the Vaccine Adverse Event Reporting System, where you can report any suspected, if you suspect that you've had a vaccine and you've had an allergic reaction, then you can report it. You can either call them at the number that's listed, or you can download a form, fill it out, and send it to them. So this is what the form would look like that you would download. It's writable, so you can actually fill this in. My highlights kind of got moved around, but here is asking information about the patient who received the vaccine, information about the person who completed this form. So if you're completing this on behalf of somebody else, like for your child, about the facility where you had the vaccine given, which vaccine were given, and what happened. So they ask you to fill this out and you send this in. Now they collect all of this information and they review and they look at how often these types of things that they are carrying. And this is how some of the adjustments and different things are made based upon the reporting system that they're getting. So it doesn't matter how small, minute it may be. If you suspect that it could be, don't hesitate to report it. So now we got all of our vaccines, we got them up to date. So how we're going to keep track of the shots and things, our immunizations that we have done. Well, in Texas, we do have what's called the immunization registry. So this is provided to everyone, children and adults. There's no national registry. However, Texas, there are state registries, and Texas does have one. And it was initiated to increase vaccine coverages across Texas. And again, they were looking at those 2 years or 24-month-old children, trying to make sure that they were vaccinated. So there was a legacy system in place that was originally called MTRAC that looked at those 24-month-old individuals, trying to track them, and in 1994. It was replaced by MTRAC 2 in 2017. So now it included where we as adults, we can participate in making sure that our record is stored in a safe place. This is a consolidated and stored in the vaccine records that are coming from, like, your doctor, from pharmacies. People that are given immunizations are reporting this to your registry and with your consent. So there's a consent form that you can fill out, and it's pretty simple as well. We'll take a look at it for minors, for adults. If you want to request to get an official copy of your record, you can fill out a form, and it's free. It doesn't cost anything. And also, if you just decide for whatever reason you don't want to participate in the region. So these are your consent forms. They're one page. Pretty much, as a minor, you're just filling this out for your child, asking for their name, your name, race, ethnicity. You sign it, date it, and send it in, and the same thing for the adult consent. So 3 easy steps. You download the form, you complete it out, and if you have like some old records, your old immunization or shot records, you can take a copy of those and you can send it in along with your consent form, and then they will update so that you'll have a more complete and accurate record that you can have access to. And then you just send it to them and they record and store this for you. And this is a safe system. You just can't log in to it. You have to either go to your doctor's office, get it, or people that are authorized, like your clinics, health clinics, and things like this, in order, and ask them to print you out a copy. Just lay people can't just go into it and just retrieve this information. They're keeping this under lock and key, but it's your information and it's available to you free. So these are some resources for you, as we talked about the disparities that exist, especially for underinsured or folks that are not insured. So there are the Vaccine for Children's program. There's also one for adults and even for graduates as part of the Harris County Public Health Clinic. Also within the Department of State Health Services, not only immunizations, but they provide maternal and child health, newborn screening, and other community health type improvements. I've shared with you the adult vaccine assessment tool. I hope that you will take a look at that, fill that out, and as adults see what immunizations you need, because we too, just like our children and our grandchildren, we need to make sure that we are immunized as well. Then there's immunization registry, to where after you've done and collected this, we see a lot of this already through those My Charts from the doctor's offices or hospital systems now that have this, where you can kind of print it out. Same type of system, I guess, but this is more centralized with the MTRAC program. And then there's theirs, where if you suspect an allergic reaction, that it can be submitted. So as any good teacher, I have to ask you some questions to see what you learn. So answer this quickly: myth or fact? True or false? You can get the flu from getting an influenza vaccine. So what do you think about this? Is this true or false? So I hope you said that it was false. This is a myth. Vaccination can prevent diseases and there's serious complications. They don't give it to you. Usually what has happened with the flu vaccine, it takes anywhere from 7 to 10 days to take full effect. So during that time period, you have already perhaps come into contact with some strand of flu. And so it's just so happened to occur at the same time that you got the flu vaccine, but the vaccination itself did not cause it. It's from circulating strands that you may have already been exposed to prior to getting the vaccination. I got my vaccines when I was a kid, so I am all set and good to go. So I hope you said that that was false too, because we talked about adults need to keep their vaccinations up to date because immunity from childhood vaccines, they can wear off over time. So we need to make sure that we are staying up to date as adults with our vaccines. So who should receive the flu vaccine? A, people over 65, only people with specific health conditions, people between 6 months and 5 years of age, of every person about 6 months and older. So it's D, every person 6 months of age and older should be receiving their flu vaccine annually. So in conclusion, despite gains in addressing immunization gaps, we know that disparities that they still exist. And with COVID, it really exacerbated everything, causing a major disruption. So as I mentioned, we're going to have to be intentional about making sure that we get back to immunizing and get our rates back up and making sure that not only our children, but even us as adults, that we are fully immunized and protected. So there are efforts to reduce gaps, such as the Vaccine for Children's program and other programs trying to address that. So those are resources that if you're not insured, underinsured, you're Medicaid eligible, we want to make sure that we're signing up for those programs and going to our health clinics where they're offering these different types of programs to make sure that our children and ourselves, that we can become immunized. So community-focused efforts like we're doing today also help to promote immunizations. And also we're hoping to build confidence in receiving vaccines. And even though we're working with some of the health systems and the disparities that exist overall, we still want to do our part in making sure that we have equitable outcomes for vaccine preventable diseases. So with that, these are my references. Thank you so much for your time and attention. And if there are any questions.
Awesome. Thank you so much, Dr. Estes, for sharing the incredible information about vaccination. And to the audience, we've had, a lot of great feedback, a lot of questions, coming back and forth. And we want to say a big thank you to everyone that has stayed connected with us and also for participating in the myth or fact. Like I can see, people, putting information in. Thank you so much. I would like to give priority to the on-site people at Estes House to see if we have any questions from that location. Dr. Loud, do we have any questions from your side?
I'm here. Can you all hear me?
Yes, we can.
All right. Thank you for having us. So one person wanted to know a little bit more about the vaccine that you take before you get COVID-19.
Okay, so more information about the vaccine or the medication that is given to protect against COVID-19.
That's correct. They just wanted to understand it a little bit more.
Okay, that was Evusheld. And again, this is an investigational medication. And it's under the EUA emergency use, kind of like when we first had COVID came out. We were waiting for full FDA approval. So this has not reached the full FDA approval stage. It's still investigational. So if they're interested in it and receiving it, they should talk to their healthcare provider to see if it's available through them about participating in receiving this medication. So I hope that
Yes,
helps address it.
thank you. And we actually had a question from one of the CHWs online about that as well. So that answers it. Thank you. Yes, Dr. Loud, any other question from your end?
No, thank you so much, Dr. Estes. That was helpful.
Okay, thank you.
Thank you. We have one question in the Q&A box. It says, I have heard from a community member that it was told that mixing COVID-19 boosters could give better protection. Is this accurate? Can we mix and match? Pfizer, Moderna, J&J.
Okay, you can mix in regards to, like, if your primary series, say, was with Pfizer, and now you're ready for your booster, and you get the Johnson & Johnson or the Moderna, it is safe to do that. CDC does recommend that you are able to do that.
Great, thank you, Dr. Estes. Then the last question I have here is, can you share any information about mortality in the state of Texas for children that are unvaccinated? Do we have any common illnesses or health issues among unvaccinated children?
I'm sorry, but I don't have any of that data that's directly looking at morbidity and mortality in Texas or in the county.
Okay, well, thank you so much to the audience. I think Ms. Roselli and myself, we've tried to answer as many questions that came through the chat box, or through the Q&A. But if there are any questions that we could not get to, please feel free to contact us by email, and we'll be glad to, share those information with you. I'll go ahead and share my screen here briefly so that we can give additional information as we wrap up in today's session. Okay, I've already posted the links to the survey for the CHW CEU certificate. Your certificate will be issued and emailed to that email address that you give in the survey, and you should be receiving this within about a week or two from now, because it takes some time for us to process all the certificates through. And we also would like you to complete the CEU evaluation just to give us feedback on, what we did today and what other topic of, of interest that you would want us to bring in our next CHW CEU. And for community members that are joining us online and also at Estes House, we want to say thank you for joining us. We want to hear feedback from you about what we've done today, as well as what you would like us to discuss in upcoming events. So please complete the survey. The survey links is also provided in the chat box. Also, we are excited to share that next month we have another engaging seminar that is upcoming, and this is going to be focusing on cancer. The title for this is Together We Can. This is cancer awareness, screening, and prevention. Please mark the calendar, save the date. It's going to be on Friday, September 9th, 2022. The same way we are having an hybrid event, this is also going to be an in-person and online event at Emancipation Park in the Third Ward, Houston area. And we would also be streaming live from 12 to 1. This programming is also going to be accredited for CHW CEU. So please, keep in contact with us. Information about registration and other details will be shared on the Dishes platform and also on the community engagement call platform. So stay connected with us, and we hope we can see you at this upcoming event. Then we are also excited to share that we have the Community Connect Plus Forum. This is an event that we have every quarter to connect with our community members, with our CHWs, with our vendors, and our collaborators. So the next one is going to be on August 15th, which is this upcoming Monday from 1 to 2 p.m. Information on how to join or connect with us can be found on all our social media platforms, and you can, register, and you will be able to have information on how to join us and share valuable information on what is happening within your community and how we can better serve you and the community around you. We also like to share information about all other, vaccination programming happening within the community. So free and low cost vaccine and back to school drive happening within the community within the next few weeks. We have Fountain of Praise and Avenue 360 Health and Wellness having an annual back to school drive and pop-up immunization clinic. This is going to be on the 20th of August. The address is shown here, and this is going to be from 11 to 2 p.m. Texas Southern University is also offering a COVID vaccine and booster series along with flu and shingles vaccine. The dates have pretty much every Thursday from 12 to 2 p.m. Location is in the Nibrit Science Building, room 143. Then the Texas Children's Hospital COVID vaccine is also ongoing. You need to make an appointment online. They have a couple of locations that might be, more convenient depending on the area of city that everyone is located in. There is also the Crystals Healthy Living Mobile Clinics, St. Austin Center. And this is located in Wayside in Houston. And they have a clinic coming up on the 15th of August from 9 to 12. And they are giving vaccination to the first 30 children within the age of 2 to 18. So, just sharing along, passing along, we've had a lot of information today about vaccine preventable diseases and how vaccination actually protects us and helps to stabilize our immune system against, preventable diseases. So let's spread the word out there and, encourage people all around us to stay on track regarding their vaccination. Once again, I want to say a big thank you to Estes House for allowing us to have this collaborative outreach event. Thank you to Dr. Loud. Thank you, Ms. Lena. Thank you to all our volunteers from TSG College of Pharmacy and Health Sciences. A big thank you to Walgreens, making it and coming through for us this afternoon as we are able to provide this incredible needed service to the community. And to our speaker for today, Dr. Estes, we appreciate you. And most importantly, to everyone that is connecting with us, all the CHWs and all community members. Today's program would not have been as successful without you. And of course, to all our vendors that are out there in the outreach location, we say thank you. We are grateful for this collaboration, and we look forward to more opportunities to connect with you as we continue to serve our community. Again, this is Texas Southern University. This is the Center for Biomedical and Minority Health Research. We are funded by NIH, and this is the Community Engagement Core. My name is Dr. Veronica Ajowale, and I have the privilege of being the director of the Community Engagement Core. Please stay connected with us on all social media platforms. Our handle is at CEC TX Southern U. That way you can get information on all the programs that we have upcoming. You can also send us a text, TSU CEC, to 855-264-9031, or give us a call, 713-313-1233. If you prefer an email, that's also fine. Our email address is cbmhrcommunity@tsu.edu. I want to say a big thank you to the leadership and administration of Texas Southern University and of the College of Pharmacy and Health Sciences for the incredible support that has been provided to us to be able to host today's program. Thank you all for staying connected with us, and we wish you a healthy summer and a great start to the fall semester. Thank you again, and see you around. Thank you.